Northumbria University has carried out research into the reasons why veterans with substance misuse have difficulty in seeking and engaging with help. Funded by the Royal British Legion, it is hoped the findings will be used by all those involved in providing help and support for veterans with substance misuse problems to provide more joined-up services which are more responsive to their needs.
Previous research that had gone before was quantitative in nature, so we understood that service personnel were drinking at high hazardous levels compared to the general population. From the Legion's own study, we understood that 1 in 10 veterans reported an alcohol-related problem. But the issue was really, we didn't understand the why. So why were they not accessing treatment? Why was help seeking so low in the veteran population? And really, the Northumbria research seeks to kind of unpick the why through these in-depth interviews with veterans and with service providers.
We've got 3 main findings in this study. So the first one is that the veterans' relationship with alcohol is normalised. And so what we mean by that is that they don't see drinking excessive amounts of alcohol as an issue, because that's what they've always done. Unfortunately, what happens in some of the cases with our participants is that drinking stayed at that level when they left service, and eventually it becomes a problem because that they don't see drinking excessive amounts of alcohol as substance misuse. It goes undetected till some other problem comes along, and that takes us on to our second finding, which was that their engagement with meaningful service, and what we mean by that is where they've actually engaged and done something about their substance misuse. On average, of the 22 that we interviewed, took 18 years. And what was key for all 22 participants was that their presentation to meaningful service was not for substance misuse. It was for another reason, be it homelessness, be it a mental health problem.
We're actually providing a veterans mental health service across North East England, and that's a small team that works specifically with veterans to help them into existing care pathways, because we understand that veterans are a hard to reach group. Research findings are kind of backing up what we're seeing. So when veterans are coming to us specifically with substance misuse issues, they're coming to us quite a long time after service, which backs up what the research has just said today. They're also coming to us with very complex issues. So it's not just a mental health, it's not just a substance misuse, there's a multiplicity of things going on there. And they've often are telling us stories where they've found it difficult to kind of engage in traditional substance misuse services in the past. So the university's done this research, and the findings kind of back up what we're saying, and hopefully from now we can kind of move forward and see what kind of services will be really responsive and accessible for veterans.